A surgeon does a lot of planning and strategizing before a patient goes under the knife. But oftentimes the full picture of that surgery doesn't become clear until well after that first cut is made. But things are about to change. Now you can join your surgeon on a 360-degree journey and explore your own surgical procedure. We're talking about virtual reality, VR for the OR. Joining us now to show how this works is neurosurgeon Dr. Curtis Auguste. Doc, this is pretty cool.
You know, it's funny. This is sweet validation for all those hours spent in the video game world that I did. My mom yelled at me all those nights, and it paid off.
Yes.
Well, you came into medicine at the perfect time, and before we get into how this actually works, because virtual reality is something that is happening, Dr. Auguste is using this. We actually have one of his patients in the audience, 15-year-old Matthias with his mother, Lindsay. Welcome. So good to have both of you. So, Matthias, I wanted to talk to you first because you actually use this virtual reality for your own brain surgery.
Yeah, it was so surreal. I mean, I had never done anything like that before, and let alone for something that I would be a part of. This past few months has been hard for me. I've been paralyzed. I lost my ability to speech, and I gained all that back, and it was all thanks to Dr. Auguste and the research that he's done and his team, and especially with this VR. I mean, it's amazing what it can do, and the possibilities that we have with it. It's just incredible.
I think it's remarkable because there are two huge benefits as I see it. One is being able to relate to your patient. And Lindsay, as a mom, I know it's so anxiety-provoking. Anybody going into your own child's brain and having this issue, being able to plan that in advance, visualize what's going to happen. So I think there's that one huge benefit. And then the second is for the surgeon, him or herself, to be able to go in and simulate what's going to happen without the repercussions, the ramifications of a real surgery, to do a test drive.
The beauty of this system is that it's immersive. It's 360 degrees. It actually shows you what you're going to see at the time of surgery, and with no harm to the patient.
And we're about to delve in and show everyone how it works, but first things first, Lindsay, I want to ask you as a mom, was this reassuring for you to be able to virtually see the surgery and what was going to take place?
Yeah, completely. I feel like we encountered a tremendous amount of suddenness and surprise with Matthias' diagnosis, and this technology was able to kind of counterbalance that just crazy amount of scariness. And Dr. Auguste was able to utilize it to elucidate his plan, and moving forward with that clarity, we were able to feel a lot more hopeful and confident about the procedure. As scary as it still was, it was really, really comforting to be able to have that knowledge at your fingertips and to feel like you could literally put your hands on what was going on in his head. And I think our whole family felt really empowered and hopeful after experiencing it.
That's great.
Now, Matthias, I want to ask you, is it okay, because we have the virtual reality model of your brain that was used to emulate your surgery. Is it okay if we take a look?
Please, I insist.
Take a walk through your brain. All right.
So show us how this works, and in so doing, you can also talk a little bit more about what you were doing in Matthias' particular case.
I recommend putting the goggle part on your face first, and then sliding that strap on the back of your head. So just look straight ahead, act natural. Okay, you're going to see what I see. Mm-hmm. And so here, hopefully you recognize this good-looking guy. This is Matthias. This is actually his face reconstructed in 3 dimensions. So this is the first view I want to show you, just to orient you. The next view I want to show you is the surgeon's view. So what do I see when I position the patient on the operating table? What kind of vantage point do I see? Well, it's this one. I'm standing at the head of the operating table. I'm going to point out for you, this is his ear. His left ear. This is his incision wrapping around here, okay? And then the first part of the surgery for him, he came to me with a bleed. And as he mentioned, it paralyzed him and it robbed him of his speaking ability. So his brain was under pressure. So the first part of the surgery was to relieve that pressure by opening up the scalp and actually performing a window in the bone. Here's the edge of the bone here. This is what we call a craniotomy. In this case, it's a craniectomy because we took the bone off and left it off. And then something caught my attention. At the corner of my eye while I was doing this surgery, I saw something here. It wasn't It wasn't kryptonite green like this, unfortunately, but it did look abnormal. So we started to remove that tissue, and at the base of it, there was the blood clot that we saw on his CAT scan. So to kind of piece the puzzle pieces together, the chicken and the egg scenario was that he had a tumor that was hiding, and it bled, and it caused some bleeding, and this is the blood clot. And both of those things combined caused the swelling in his brain. The next view is the surgery where we went back to finally tackle the last bits of this tumor. One thing I didn't tell you is that it's tucked away in there. You know, you can barely see the whole tumor, and there's some very important stuff back there. There's a structure called the superior sagittal sinus. That's the main way out for the blood at the top of your head, top of your brain. I can't see that. It's hidden from me. And I always had this thought as I was preparing for surgeries in the past, man, if only I could shrink myself down to really itty-bitty size and fly my way in. So what you can do now with VR technology is you have the ability to take a walk, immerse yourself into the anatomy in 3 dimensions, and remember, you are in this space, this 3-dimensional space. So now I'm actually standing inside of Matthias's brain. I'm going to look over my shoulder, and lo and behold, I can see the tumor in great detail now. And what I couldn't appreciate on his 2-dimensional images was that there was this huge pipe going through it. So his tumor had actually wrapped around that superior sagittal sinus the way that I was worried about. And if I had chased it that first surgery, we could have really hurt him. So I have a little bit of fun for you guys now. So I've been your tour guide, but with the price of admission, you get to walk around the museum on your own now.
And are the blue and the yellow that we see each other's avatars? Is that us
That's
walking
correct.
around?
And I'm gonna just zoom out a little bit here. Okay.
Oh my gosh.
Superman!
There you go. Yeah.
And I love that it even has the anatomy labeled so you can orient yourself.
Yeah, so I put a little bit of a scavenger hunt here for you guys to bring you back to day 4 of medical school. Some important anatomy is where does your motor and sensory cortex live? Where do your speech centers, your Wernicke's area and your Broca's live? There's actually vision tucked away back behind the tumor. You are welcome with your hand controllers now. Your left thumb controls forward and back, so if you push the left thumb joystick forward and up, you'll fly in. And then you can use the right joystick to look right and left. But remind yourself, your head is a joystick too. So you can look around all you want and see different things just with your head movements.
This is truly remarkable.
It's fantastic. So
I see you there, Superman.
Yeah. Is this only available in neurosurgery now? Are there
no.
other areas where
No,
it's
not at
being
all.
used?
Any situation where you have a 2-dimensional set of images that you want to reconstruct a 3-dimensional image is applicable for this device.
Wow, I see so many applications with microsurgery, with ear surgery, eye surgery.
But let me ask you, in terms of the more emergent surgeries, how using this technology, in Matthias' case, this was after the initial surgeries, how long does it take to set up this virtual reality model? In other words, as you mentioned, that tumor is in such a position that you had to be very careful with the surgery you planned. If a surgery were a little more emergent, how long does it take to get all of this set up, if you will?
To build a case, to go from 2D to 3D, takes about 20 minutes. I wish I could get my patient from the scanner to the OR
That
in
is
20 minutes.
remarkable, because I was thinking
so
days and days.
20 minutes.
So this truly could have emergent applications.
absolutely.
At some point, you could literally have a patient in the emergency department and have an emergent situation. You need to plan the brain surgery right then and there. What's the best way to do it? And by the time you're in the OR, could be using virtual reality.
Absolutely. I mean, I hope that by the end of my career, we'll look back and think, well, how do we ever take care of these patients without the use of VR in these emergent situations?
I mean,
it's quick.
Even if there's a fracture or a bony, it doesn't even have to be a tumor. I mean, it certainly
2D to
could be
3D,
any sort of traumatic situation where you're just trying to model that reconstruction.
Yeah, and we really are at the ground
Fantastic.
floor of this. So we're just now understanding what the boundaries are and how far we can take it. So it's an exciting time.
And Matthias, I want to say thank you so much for letting us go on that journey with you.
Oh, of course.
How are you doing overall right now?
Okay, so I'm doing great. I mean, I'm running again, and I'm doing everything I was able to do before. I mean, it's amazing what he was able to do with the VR. I mean, it's
So no
been a great
limitation.
experience.